I just want to start off with, if you could briefly explain what TremPro Medical is.
Well, TremPro Medical is a clinic that focuses on treating chronic diseases with particular focus on Alzheimer's disease. The reason why this is important is we're really good in the United States at treating acute, immediate diseases, but we do a poor job at treating chronic diseases, and they constitute about 65% of all disease in the United States.
What do you look for initially as a diagnostic company?
Right.
TremPro Medical.
What we say is that everybody wants to know treatment for Alzheimer's, treatment for cancer. What is the treatment?
Yeah.
It's not the treatment, it's the diagnosis. If you don't have a broad and deep, in-depth, thoughtful diagnosis, then what are you treating? You're treating symptoms. So that's the issue we have today in modern medicine. We're treating symptoms. So our diagnostic process is a multi-step process that really goes down to the root cause of disease and then gives the doctor a real good roadmap to treatment. So I'd say diagnosis is 90% of the process, treatment only 10%.
And in that process, how do you go about looking at it? I mean, what is your process?
Right. Well, we want to detect disease early. And a lot of people have disease, but they're unaware of it because the body is very robust and is able to compensate for a lot of ills and wrongs. So a lot of people are walking around with disease and don't know it. So early detection is the key. So it turns out that the eye is a really good marker for disease early on, and the eye contains biomarkers for both nervous tissue. It's part of the brain, so we can see Alzheimer's very early in the eye, and it's also a very good way to look at the health of the cardiovascular system. And we believe the two are connected anyway. But just think if you're a cardiologist, you'd like to open up someone's chest and look at the health of the vessels.
Yeah.
Well, in the eye, we just use a magnifying glass, a microscope, if you will, and we look in and we see the vessels. They're the same vessels that carry the blood that are in the heart. So we get a good feeling for your overall health just by looking at the eye.
So in today's standard of care, what are they doing wrong? How are they treating and diagnosing? I mean, obviously it's not working, or they're just going about it wrong.
I think we look at disease in isolation. So Alzheimer's disease, it's a constellation of symptoms associated with the brain. So neurology owns Alzheimer's disease. They look at the brain only. They don't look beyond that. And when you talk about symptoms, executive function, lack of memory, these are symptoms. These aren't root causes of disease. Alzheimer's, as a label, is a syndrome. It does not describe root cause. So you really have to, we've failed through looking just at the brain. We've got to look at the whole body for root causes, and that's what we're doing at TremPro Medical.
So what you're saying is that you've broken the barriers between the neurologist and all these other professionals to come together to take a look at it systemically? Is that
you
what you're
really
saying?
have to look at the disease from an integrated perspective, and even the Alzheimer's Association says that Alzheimer's disease is a multifactorial disease. So that says it's not just a disease of the brain. There's a lot of other processes, and clearly the body is highly connected. I mean, one red blood cell can course through your heart every 10 seconds during aggressive physical activity. That shows you the connectivity of the body.
Are there other individuals out there, looking at this the way you look at it?
Well, I'd like to think so, and our founder and inspiration, Dr. Clement Tremp, is fairly unique because of his use of the eye to look at the brain and the circulatory system all in one fell swoop. But yes, there are certainly a number of researchers that agree with our thesis. Dr. Judith McCloskey out of Switzerland believes that there's a strong inflammatory and infectious component. Dr. Bruce Balin in the University of Pennsylvania has shown various infectious species in the brain, and in fact in the so-called senile or beta amyloid plaques. So there are a lot of people who share that but from a clinical perspective, there are very few that are implementing this kind of methodology to help people get better.
How do you see changing that belief structure? Standard of care being this, the way it is, it's a monster. What's your process of getting it out there?
Well, I think what we have to do is prove the benefit of our methodology.
Okay.
And I think what our methodology does in the long run is it saves costs.
Yeah.
It saves a lot of money. If
How
you're
much?
just, if your loved one has to go into nursing care, that depending on where you are in the world or in this country, it can be $8,000 to $10,000 to $12,000 a month. Someone's carrying the burden of that cost, either the family until they're broke and on Medicaid,
Yeah.
or the government, which all comes from us anyway.
Yes.
So
Direct
if we
and
can
indirect.
avoid a person going to nursing care by a year, figure it's around $100,000 a year in cost savings to a family. Multiply that. Reagan was in intensive care, nursing care for almost 10 years. That's $1 million.